Good afternoon and welcome to our TAD webinar, Insurance Verification and Eligibility. TAD was founded to provide an option for home health agencies to outsource their billing, accounting, and consulting services to industry experts. Our esteemed billing specialists, accountants, and CPAs have dedicated themselves to the home healthcare industry and bring their wealth of knowledge to you today. My name is Candy, and I will be your moderator for today. It is my pleasure to introduce Tony Elkins. Tony has over 25 years of medical billing experience, including employment within various home care agencies throughout her career. She has the ability to research troublesome processes within home care agencies and offer practical solutions. We have a lot to share with you today, so we are going to get started. All of our attendees are on listen only mode, but please feel free to send your questions to us during the webinar via the question box on the right of your screen, and we will answer them as time allows. At the end of the webinar, we will post contact information so that you may contact us if you have questions or would like to discuss our services. A brief questionnaire will pop after you leave the webinar, and we would appreciate if you could take a moment to give us some feedback as to how we are doing. Please visit our website frequently to check for upcoming webinars. Enjoy the webinar. Here is Tony.
Thank you, Candy. And I also would like to welcome everyone to our Insurance Eligibility and Verification webinar. Today, we're going to be covering pertinent information that should be considered before rendering services for both Medicare as well as non-Medicare payers. So let's get started. Today, we're going to talk about a couple of options for insurance verification for Medicare. CWF, which is the Common Working File, which generally is accessed when you go through the Medicare intermediaries. Oh, sorry about that. We have a little technical difficulty. I need to speak a little louder, I'm assuming. Please let me know if this is better um, in terms of being able to hear me speak. Thank you so much for that response. The options we're going to consider again will be the CWF, which is the Common Working File, which is accessible through your intermediaries, as well as the HET system, which is going to be accessed via an IVR system, various vendors, as well as the intermediary website. With the HET system, we know that Medicare had made an announcement that there would be changes made to the HET system back in 2014. As of today, the change where the Common Working File would no longer be accessible has not occurred. So it is still available for use. Medicare did promise that before they would remove that CWF, that Common Working File, to be able to go in through the Medicare systems using the HIQ-H or the ELGA or HIQ-A. Medicare would notify the providers and give them at least a 90-day notice before it would be removed. But the ultimate goal for Medicare is for agencies to use the HET system. And that HET systems was an acronym for the HIPAA Eligibility Transaction System. This is the last update, one of the updates that was issued concerning that change. And again, you can see the date, April 14th, when this was first implemented. But again, it has not occurred, and CMS said that they will provide us that 90-day notice. Today, we're going to look at the Ability Network system that's in place for doing eligibility. TAD does not endorse any vendor over another. This is just one that we're using for this demonstration for this webinar. So with the Ability Network, you would still need to put in the patient's information in order to do an eligibility. You want to make sure that you give attention to the correct spelling of the name as well as the date of birth. If this information is not correct, if the name is not spelled correctly, or if the date of birth is not correctly, you would not be able to get a return on the information. The common working file was a little more flexible. If you didn't have the exact birthday, it still allowed agencies to put in the information. But using the HET system, you have to make sure that you are using the correct information as well as the spelling. Even if the person has a hyphenated name, you want to make sure you do that. If it's a junior or a senior, if that's a part of their name, it's just that sensitive. It has to be the exact information that Medicare has on file in order for the HET system to work. Also, when you're putting in your information in terms of your provider information, as of 2018, the HET system as well as the common working file, you have to have your provider NPI number in order to get a return on your eligibility checks. You no longer can use the common working file to run an eligibility check using your Medicare provider ID number. Once you put the information in and you get the return, this is a screenshot that is an example that shows that this patient does have coverage, and you see the lower portion of the screen. It has the Medicare eligibility period. There is no termination date. So in this example, this shows that this patient does have Medicare actively. The information also that will be displayed will be information such as deductibles, caps, and plan coverages. Home care currently does not have a need for deductibles. So even though this information is displayed, it does not have an impact on your Medicare reimbursement. The lower portion talks about the plan coverage. In this example, it has a plan type, which is a HMO, a health maintenance organization. And it says that this patient's HMO is through this community insurance company. When a patient has an HMO, a Medicare HMO, it is not a second insurance that the patient have in addition to the Medicare plan. It is the HMO that is going to administer the benefits for that patient. So if you're doing an eligibility check and you notice that the patient has an Advantage plan or an HMO, then you need to contact the insurance that's listed under that plan coverage, because that's where your claim is going to go to be processed. Also, you'll see information concerning Medicare secondary payers, or MSP. If you see any information displayed in this field, it's letting you know that Medicare has determined that there's an assurance out there that should pay for coverage before Medicare does. And if that's the case, you need to make sure that you have a Medicare secondary payer questionnaire that will act as a flow chart to direct you to show you Medicare's liability or responsibility, excuse me, in relation to this plan. It's possible for Medicare not to be the secondary. For instance, in this example, the type of primary insurance, it says it's other liability insurance is primary. If the care that you are rendering the patient as the home care company, if it's not related to that liability injury, then Medicare will still process your claim as primary. But in the event that the care may be related to the liability insurance, then Medicare will consider themselves to be secondary, and they would wish that you provide your claim to that primary insurance first. And after they process the claim, if there's a patient copay or deductible, then Medicare would like you to submit that portion to them to be processed. That's only if the care is related to that liability. Other type of secondary situations may be a workers' comp situation, or an employee large group health plan. In those instances, you would need to contact those insurance companies because they're saying that they're primary, and it could be that they're primary because of a spouse relationship with that Medicare recipient. If the spouse is employed and they have that Medicare recipient listed on their policy, that working policy is primary over the Medicare. And in that instance, again, you would automatically reach out to that other insurance company. Also, you want to give attention to the home health certification information. This area will let you know if there is another home care agency that is actively providing services for that patient, because you don't want to run into a situation where you see that the patient has Medicare and you just go ahead and admit that patient is actively being seen by another home care agency. Two home care agencies cannot provide dual services for a member. You have to determine which one will be the primary home care agency. If you run an eligibility check and you see that the patient is currently active with another home care agency, but the patient would like to be serviced by your agency, it's not a problem. You simply need to coordinate that care with that primary home care agency. A lot of agencies, they make sure they get the beneficiary elected transfer form filled out, but it doesn't stop there. There has to be some type of communication between the two home care agencies to determine when one care will stop and the other will begin. You don't want to just get the referral, put a transfer code on your claim and bill Medicare. That may result in your wrap paying, but when it's time for final billing, when all those dates are being reported by both agencies, Medicare is going to hold up those payments because they will not have a clear agency listed as that primary home care agency. So again, you want to try to do this in the beginning. You get your eligibility. If there's an active home care agency out there, get in touch with them. Document who you spoke with, coordinate a day. If you get a referral today, you don't want to say, I'm starting my home care services today, because 9 times out of 10, the other agency's field staff may have already made a visit today. So that means you're still going to run into at least one date of overlapping services. So if at all possible, my suggestion is that you try to go for the following day of the referral after you had a communication with that current home care agency. Also, it's good to um, drop your wraps as soon as possible, because this information that we're looking at, it's actually populated based on your wrap information. Um, Before you submit your wrap, though, you want to make sure that there's 4 things that you have completed, which is that you have done your OASIS assessment and it is locked and ready to be exported. You have your verbal order from the physician that referred the home care patient to you. That plan of care, or that 45, has been completed and mailed out to the physician, and you want to have that first billable visit completed. If you have those 4 things met and you send your wrap to Medicare, and Medicare can process that wrap, this area will be updated so other agencies will be able to recognize that there is a home care agency out. When you delay submitting your wrap, then the information on the common working file or in the head system is not going to be accurate. And sometimes agencies have to file provider disputes because information may not have been clear at that time. So to prevent that, you want to make sure that you do your eligibility check, get those 4 things done, and you want to get the bill as soon as possible. One thing here at TAD, we do bill daily for our agencies, so when they say that they have a wrap that's ready, TAD is more than capable of making sure those claims are sent out so that this information is populated for our clients. Another thing that this area does for home care agencies, it also helps with episode timing. When you're doing an OASIS assessment, they want to know whether or not you're admitting a patient as an early episode timing or late episode timing. Well, looking here, you'll be able to tell if there are any agencies that are within your 60-day period to say whether or not it's an adjacent episode or not. So there's a lot of information that home care agencies can ascertain just from doing this eligibility check and looking at this screen. Um, Another field that you want to pay attention to is whether or not there's any hospice information listed for the patient. For this particular example, you have I'm a sick patient who does have an active hospice election. Now, some agencies feel that if the patient has an active hospice election, that the patient cannot be admitted. That's not true. Um, if the medical care that the patient needs from the home care agency is not related to the terminal condition of the patient, then that home care agency, they are able to go in and provide the medical care that's unrelated to the hospice diagnosis. So you want to do your eligibility check. If there's a hospice, determine what the diagnosis is for that terminal condition to see whether or not your care is a duplicate service of this hospice care. So just another area that you want to make sure that you focus on when you're doing that Medicare eligibility. This is the same screen, same information that comes up that you're still focusing on with this hospice example. Still your plan coverage information, home health information if it's there. So these are just duplicate screens for the information, but now we're just looking at it in terms of a hospice related issue. Medicare insurance eligibility, we're going to talk a little bit more about being able to do a HET system using the intermediary websites. When you're doing the HETS verification using vendors such as the one that we looked at with Ability, when you use those vendors, it is a contracted service and it does come with a fee. However, Medicare does have, the intermediaries, they do have free options to do eligibility check. And we're just going to take a look at a couple of the intermediaries just to see what their screens look like. This is an example of a Palmetto eligibility. Their search is through what's called the OPS, or the Online Provider Services. You register for this and you're able to go in and do your different eligibility, as well as some other features that's out there for you if you are part of the Palmetto intermediary. Once you put in your patient information, you have your banner across the top, or your menu. You would choose the option, that fourth one, which is eligibility. And then you'd come down and you'd put in that subscriber information, the last name, the birthday, and the same information applies. It has to be spelled correctly. Birthday has to be entered correctly, as well as the Medicare ID number. And speaking of the Medicare ID number, some of you out there may have noticed that there has been some changes with the Medicare ID number. We know that Medicare had talked about updating those Medicare ID numbers, and it was implemented, well, it started in April 2018, and there is a transition period that's currently underway. And that transition, when all these Medicare recipients are going to have their ID numbers changed over, it's going to occur between April of 2018 through December 31st, 2019. So you're still able to go in and do your eligibility checks, or even use the common working file using either ID number for now, but ultimately the goal is to do away with the old ID numbers and start using the new Medicare ID numbers that are being assigned to the members. So back to the Palmetto example. Once you put in that information, it gives you a return. It still tells you your Medicare eligibility, Part A or Part B, if it's terminated. I've had questions posed to me before concerning eligibility checks where there is no Part A, but there's Part B only, and an agency wants to know, can they still provide services? The answer would be yes to that question. Even though home health care is a Part A benefit, home care is payable under either Part A or Part B entitlement. So as long as they have one or the other active, or both, you are able to provide home care services benefit under either Part A or Part B benefit. So continue with the Palmetto example, you still have the same information. It lets you know if the patient is enrolled in a Medicare Advantage plan or an HMO. And it also tells you whether or not there is a Medicare secondary payer out there that you need to be addressing. And it gives you the information about the other home care agency. And again, um, it provides you with the provider NPI number as opposed to the Medicare PTAN or provider ID number. I can't appreciate using the NPI number these days because now you're able to take that NPI number and do an NPI search and get all of the information concerning that provider, their address, telephone numbers. Before, with the Medicare ID number or the PTAN, you'd have to call Medicare, give them the PTAN number, then they tell you who that member is. But now with the NPI number, you're able to go in and just search it yourself. So I do appreciate using the NPI numbers. Connects is the system, the free system that the National Government Service Intermediary uses. And this is an example of their screenshot. It looks different, but the same information, it is there. You look closely, you can see the beneficiary information at the top, the coverage area, and then in the middle of the screen, it shows you whether or not there's a Medicare Advantage plan for this patient. And then this is just a quick example for those intermediaries that may be affiliated with the CGS. CGS portal was called My CGS. And this is just a screenshot of the NPI registry. As I stated, because now we're getting the NPI numbers for the providers, you're able to take that information and just go in, put in that NPI number, and it gives you all of the information that you need in order to contact that. So it's beneficial because you want to be able to reach these agencies that may be open with an episode as soon as possible so as to be able to get your referral processed and be able to get your wrap dropped and make sure that you're able to establish your home care as the agency of choice. Other insurance providers outside of the Medicare Advantage plans and the Medicare HMOs are commercial payers. You have Medicaid's out there, and patient pays. All of these are other forms of revenue that an agency can avail himself of because nowadays, no one's just strictly Medicare anymore. You have to be open and adaptable to taking other insurance companies. TAD, again, we provide billing services not just for Medicare recipients, but also for commercial recipients. So if you find that you are in need of assistance with commercial pay or commercial billing and you want to speak to someone here at TAD, we are available. Just give us a phone call and we can talk a little bit more about billing those non-Medicare patients for you as well. When it comes to Medicare HMOs, just because a patient is enrolled in a Medicare HMO and you don't have a contract with them, it doesn't mean that you can't service them. You just want to make sure that you are reaching out, not just to the Medicare HMOs, but for all of your commercial payers. You want to reach out to them and have a conversation with them to find out if, in fact, you can still service the patient. For example, Humana, they're out there. You may not be a Humana contracted provider, but Humana does have some plans out there where you can provide your home care services for their members just as a certified home care agency. But you want to reach out to these different insurance companies and you want to avoid non-payment by diligently checking to see what insurance company your patient is currently enrolled with. You want to make sure you do your eligibility, find out which periods are covered for that particular insurance provider, because a lot of times you could be in the middle of your 6-day episode when that patient changes. So there's a portion that's going to be payable under the traditional Medicare and a portion that may be payable under the Advantage plan. So you want to make sure when you're doing the eligibility, you find out which periods are covered, whether or not authorization is required. Find out what's your timely billing, how long do you have to get a claim over to them, how much can you expect to be paid as a contractor or a non-contracted provider, as well as getting the update of your of that patient's contract number, because you're no longer going to be operating under that Medicare provider ID number because they have a different insurance company. That contract number is going to change. So you want to make sure that you have that so you can get that on the claim so as to avoid delay in your claims processing. And you want to train your staff to be alert to the changing needs of the patient when they're going in and they're doing an assessment. You don't want them to just ask to see their Medicare information. You want to make sure they're asking to see all insurance information because it may be something that you weren't aware of that the patient has out there. And I love this line that when you're calling these insurance companies for these authorizations, they let you know that a verification of coverage and authorization does not guarantee payment. So you want to make sure that you're having this conversation with these insurance companies before you provide service to find out you can make sure you can do everything you can in your power to prevent a non-payment because an authorization wasn't given in time. There is no retro authorization, or you didn't know that the patient was associated with that insurance company. So make sure that you're doing all these things, and even still, it doesn't guarantee payment. This is an example of a commercial insurance verification form, just something that Tad has put together. So when you're calling these insurance companies, you want to make sure that you're documenting this information. Um, who the patient is, again, what's that new insurance ID number, the telephone number or fax number associated with that non-Medicare insurance company, whether or not this individual, if they have in-network or out-of-network benefit, is there a copay or deductible that's associated with their care? If there is a deductible, how much is that deductible? Has it been met? How much is owed? It's because you're going to need to know this because that's going to move you into patient pays. TAD does bill patient pays for their agencies. It's important that you continue to follow up to make sure that you're billing all the necessary payers in order. And also, again, the filing limit. Prior authorization. What's that authorization number? Was there pre-certification? What disciplines was the authorization given for? Were there any specific instructions related to that authorization? You know, do an eval visit and send the notes over. Whatever it is, you want to put those instruction down. Gather as much information you can in the beginning so as to prevent a loss of revenue. And again, this is just an example of an insurance verification form that you can use. Your non-Medicare payer, non-contracted payers, some agencies feel like there's a disadvantage because there's a lot of work that may be involved. You have that form that needs to be filled out. You have notes that you need to fax over. You have a hard copy claim that needs to be accompanied with this. Whatever it is, you want to determine on the administrative end whether or not you want to do these extra steps. But again, more and more patients are not just traditional. You have a lot more insurance companies that you have to do business with. So before you just say, no, it's not Medicare, you might want to consider whether or not you want to move into this avenue. And then you also have patient pays. The patient may want to just have a relationship with you where they'll pay out of pocket. That's always an option out there for you. You want to make sure that if you do decide to do a patient pay, that you have some type of contractual understanding between the two parties and that they know what's expected of from the agency as well as what you're expecting from them. Do you want to deposit on the services before you render care? How often will you bill them? And when is that payment required? These are things that you might want to consider when you're doing like a private duty or a patient pay. It's still another option out there for revenue for home care agencies. Well, that's what I had to share with you guys today. I didn't have very many questions coming in, but we will be here for a second just in case there's something you want to ask or you need me to go over. So I'll just wait a moment to see if there's any more questions to come in.
Okay, Tony, we have a question here from Rachel Holcomb, and she was asking, what is HETS?
HETS is the healthcare eligibility um, transaction system that Medicare is implementing for eligibility. Before, when we were doing home health care eligibility, everything was through the common working file. We would sign in and go to HIQH and we do an eligibility. But Medicare plan is to no longer have that system in place. They want everyone to go to this HIPAA eligibility transaction system. And the example that I was showing um, early on, excuse me for backing up through these slides. I just want to go back to those screenshots. The example that I was showing was Ability Network, where you use it to go in to do eligibility. It's still linked to the common working file. It's just not coming directly through the common working file. And Medicare said that eventually it's going to go away. It has not. There are some other network vendors out there that agencies may be using, such as eSolution, McKesson, Med, TransDirect. There's a lot of them out there. But if you're able to do eligibility with the common working file, you're fine for now. But eventually, Medicare's goal is to have all agencies move from away from that HIQA method and go through a vendor to get the insurance eligibility information. Thank you for your question. Not trying to give anyone vertigo. I'm just trying to move back through the slides. Okay, well, I thank you guys for attending. Candy.
As you heard today, there is a lot to know about insurance verification and eligibility. If you're not already one of our valued clients, Tad would love to assist you and your agency with your billing and accounting needs. The professionals at TAD have been providing accounting and billing services to home health agencies for more than 15 years and doing tax over 30 years. So often agencies are owned and managed by critical professionals who can't keep up with the constantly changing Medicare and IRS regulations. At TAD, all we do is home health accounting, billing, and tax work so that agencies are free to focus on the clinical and daily operations of their business. At TAD, we say manage your capabilities and outsource your challenges. We want to make sure that you're getting paid everything you're entitled to collect. We hope you will consider using TAD for your accounting and billing needs. Again, thank you everyone.